Last winter I got the flu. The memory is quite fresh. It was no fun. And I know I was not alone. 5% to 20% of the US population, on average, gets the flu every year. Like clockwork, flu season hits every single year. It means more people get sick and clinics get super busy. It is overwhelming for healthcare providers. Everybody seems to get sick at once, including the staff. This is where I enter the picture. My name is Cecilia. I am a data analyst information, and I will look into CDC data to help with this challenge. My goal is to help a medical staffing agency that provides temporary workers to clinics and hospitals to determine when and where to send extra staff for the upcoming influenza season. Let's see what the flu usually looks like in the US. I looked into CDC data from 2010 to 2016. The chart on the left shows that even though some US regions experience higher volumes of patients with flu-like symptoms during the winter, there's a clear pattern of peaks and valleys throughout the years. The peaks occur in winter and the valleys occur in summer. Every season is the same, with this slight difference in the number among the regions. The bar chart on the right shows the monthly variation of the disease. Cases increase from November to March, usually peaking in January. Cold season is definitely flu season. Some months experience an uptick in flu patients and a shortage of healthcare providers. This combination worsens the burden of flu cases. Here we can see two different analyses. We zoomed in on two states, New York and Alabama. In New York, this combination happened in February and December. This is a historical analysis. In Alabama, December was the only month with a stark disproportion between the number of healthcare providers and the volume of patients with flu-like symptoms. Ideally, these two lines should follow the same trend of ascents and descents. So applying this analysis to each state can identify the specific months of highest need per state. This map shows influenza mortality rates per 100,000 residents by state. The states in dark red are the flu hotspots. We can see that neighboring states can exhibit very different scenarios. The ranking below shows all states listed from highest to lowest mortality rate. Now we can finally address the project's questions. When and where to send extra staff for the upcoming influenza season? I recommend deploying additional staff from November to March to address peak flu season. States identified as flu hotspots due to their high influenza mortality rates should be prioritized. This is the link to the chart with number of healthcare providers and percentage of patients with flu-like symptoms by month. It is possible to filter by state and learn which months within the flu season should be prioritized. Below is my analysis with the top 10 flu hotspots and the months that should be a priority for each one of these states. In conclusion, by understanding flu's variability and targeting hotspots, we can strengthen our response to this threat. And as a result, we expect to reduce patients' wait times, improve patient care, and reduce strain on staff. The very last recommendation is to monitor patient and staff satisfaction through electronic surveys and adjust the response as necessary. Thank you.